Hey everybody, I'm Dr. Quinn here at Ozark Holistic Center, and today I actually asked a client of ours, Delaney, to come and sit down with me, and she's been so gracious to do so, to come and sit down with me and talk a little bit about her experience with us, because Delaney was actually one of the first Lyme clients that I worked with to kind of give her the support and go through that whole process of working and helping her with that condition. And so I wanted to bring her on here and just kind of give a little bit of explanation and talk through kind of an interview of how that went for her, because it was kind of an interesting experience. So it was like 4 or 5 years ago that she first came to me. But I first want to just actually ask her what your story, your background a little bit, because you actually contracted it way before you ever came and saw me. And so, yeah, go.
All right, well. So I first contracted it when I was 12 years old, but I was unaware of it because I never had the bullseye rash, but I had a couple ticks that had been on my leg at camp for just over 24 hours, and they had left like little scars for, anyway. But then, so as far as I could tell, nothing was going on. I had no concern about it. You know, it wasn't in the area.
Yeah.
You know, Lyme wasn't a worry, you know, here in Arkansas, and so it's never even crossed my mind. But then, when I was about 15, going on 16, I started having a lot of issues. I had extreme joint pain and stomach aches and fatigue. And so that just, so that's when it all started, was when I was about 16. And that summer I ended up getting so weak that I had to stay in a wheelchair for a few months while we were trying to figure out what was going on. Let's see, I finally found a doctor he saw the scars on my legs and goes, well, what are these from? And I was like, well, they're from tick bites a few years ago. And so he thought that we should test for Lyme because, you know, that could, you know, be the cause. Yeah. Anyway, so he tested for it, but he didn't put it in my medical records because he was afraid he was going to lose his license.
Right, and she referenced this earlier, and part of the reason why is because, here in Arkansas, we supposedly don't have Lyme disease, and that's something that you guys were kind of aware of or made aware of.
Yeah.
Earlier on in that process. We now officially do, like, we actually, somebody in this area, I happen to have actually met them. They're actually a good friend of Amber up front, had 2 children that got it, diagnosed with it, and pushed extremely hard to get those 2 cases actually accepted by the CDC as saying now that there actually has been proven cases of Lyme disease here in Arkansas.
Yes. That's so great that it's official.
It's official, right? It's officially there. So then you said it was 16 when you first started showing the symptoms of it.
Yeah.
Put you in a wheelchair at one point in time.
Yeah.
And then the doctor, I mean, you're actually pretty lucky that doctor kind of picked up on that and said, hey, what are these?
Yes.
We should probably run this test.
Yeah, I mean, if I had worn jeans that day, he wouldn't have even seen the scars. He wouldn't have known to ask, and we probably, you know, who knows when we would have picked that up.
Actually identified it. Yeah.
Yeah, but so then I was on heavy antibiotics, which sent it into remission for a little bit, and I was able to regain strength and walk. And he said that I probably still have some residual issues, some joint pain, probably for the rest of my life. But he said the Lyme was gone. Because at the time, we believed that antibiotics could kill it off completely, which, you know, now, especially if you've had it even for over 72 hours, it's really hard to kill, right? With
the antibiotics, yeah. Mm-hmm. And I was going to say that actually, you kind of got lucky that the antibiotics even worked at that point in time, because you said the original bites were a year earlier or a couple years earlier?
It would have been 3 years.
3 years
prior
earlier.
To that.
Prior. Yeah, and so then you're kind of lucky because usually you have kind of a 30-day window of starting those antibiotics when they're the most effective. And so if you're outside of that 30-day window, a lot of times they'll need to prove to be effective. So.
Yeah, I do remember I was on a couple of different strong antibiotics.
Yeah.
Yeah, but So anyway, so it was in remission for a while, but I did know I always had the joint pain, and I still was having stomach problems, and I started being sensitive to different foods as well that year.
That's right.
But since we thought the Lyme was gone, and they were saying Lyme isn't in Arkansas, you know, but I started having more and more joint pain and fatigue, and I saw, like, I had seen several different doctors to try and get the pain under control, trying different medicines that would end up giving me more side effects, you know, and like the medicine would work for maybe a week or two, but then it would end up, you know, like not working, and it'd always come back. And so I ended up seeing a rheumatologist who diagnosed me with fibromyalgia.
Okay.
Then he, like, you know, did the whole pressure points
Yeah.
test
Yeah.
and all that, and so that's just what I thought I had, and I thought I'd have it, you know, again for the rest of my life. And then over the years, there's been more and more research done on Lyme disease, which I have followed pretty closely just because of the closeness. And one of the things that I read that it could mimic was fibromyalgia, that the Lyme could
Yes.
present as
Yes,
different
absolutely.
as different diseases and
Yes.
stuff like that. So I'm trying to remember. There was at one point when I realized that I had Lyme disease and it wasn't fibromyalgia. I'm trying to remember.
Kind of like what happened.
Yeah, I know something happened to where we found out that it was the Lyme, but again, we thought that it was too late for any kind of treatments, you know.
Yeah, and then fast forward a little bit, and you kind of hear about me, and our office, and you come in. See, I remember us talking about your history and that you'd had it, and I think you guys were still kind of open to like, what is this? You might have already known, but maybe you just were a little bit like hesitant to be like, I really do have Lyme, right?
Yeah, that's right.
And so we went through our kind of muscle testing process, and in that process, I kind of ruled it down and identified it to
be Lyme.
To be Lyme. And I remember saying, like, you know, it was in your history, and I'm also finding it still now. I still think that's what's going on. And then you guys said, well, we kind of thought that was still what was going on.
Yeah. There hadn't been anything official, you know, where like, yes, this is it. But just from reading up about it, it's like, pretty sure this is what I have, but.
And it just never left you.
Yeah.
Went in remission, came back out. And so how old were you when so you got it back then, and by the time we even met, I think you were 20s, early 20s?
Yeah, I was 22.
22.
Yeah.
Okay.
I was 22, and the summers were always worse, right? And it was in the summertime when we met you, and I was having a particularly rough summer. I had like zero energy. I was in so much pain. You know, I stopped working, and Nephi met you, and he told me that, you know, he thought you could help. Not necessarily promising me a, you know, full recovery or treatment, but just like, hey, I might be able to help you manage your symptoms at least, you know, or just, you know, come in and see me. And I was actually really skeptical.
Yeah.
Because I had been to so many doctors, like even, you know, holistic, and, you know, and so I was like, well, okay, I don't really know if I want to go through this again, where I get my hopes up and then they get dashed, you know. But Nephi was really excited about it, so.
Yeah, so he was like, I remember.
So I was doing it for him. I was going to come talk to you. But that first appointment, like, when you started talking about Lyme disease, you actually knew what you were talking about.
Yeah.
You know, and because there are so many doctors that, you know, no offense to them, but, you know, they just.
Right, it's kind of just like another thing. It's just like, oh, okay, you must have Lyme, and this is what should get rid of it, and I don't know. And they just keep it real simple when this is really complex disease.
Yeah.
This is really complex infection that you're actually battling. And so we, in that process, go through, identify it was there, and then we identify what herbs in particular that she needed to combat that. And there's one particular system I've used now for a lot of years, which is a combination of 2 different herbs. And I remember that's what we used for you. And we kind of checked in multiple times in that process, and you continued to actually test well for those particular set of herbs. So if I remember right, we kept you on the same 2 tinctures for pretty much the entire time. And the whole process took about 2 months in your case, which was really surprising for how long she'd had it. Because usually the longer someone has it, the longer it takes. But in her case, it still wasn't any fun. So like, I think that's kind of what happened. It's almost like somehow we kind of compacted the whole recovery, the whole process into 2 months. And I remember like within just a couple weeks, you either coming in or calling and saying, it's kind of worse than ever.
It hit me really hard. But I remember in that first appointment you said that it would probably get worse before it got better.
Yeah.
So I was trusting on that. Let's see. Yeah, so I started taking the herbs, and we attacked it from different angles. You know, the herbs that I was taking through diet, eat restrictions.
That's right.
I don't remember if there's anything else that we did. But.
So yeah, the food restrictions were in there. So we took out quite a bit of foods in her case. We're trying to figure out anything that's going to lower inflammation levels, and that's part of it that you're sensitive to. You're trying to actually, the reason why we do that is you're trying to remove any loads on the body so that the detoxification process can work as effectively as possible. And actually, as a side note, I've never said this to her, but over the years, I've actually gotten a lot better at kind of preventing or eliminating that initial strong reaction. So if you would go through it now, my hope would be that we actually wouldn't have such a big reaction as you did then. And we've actually figured out by changing some of the herbs during the process, we can eliminate that, which is not what we did with you. We kept you on the same set throughout the whole process. But it still ended up working. I remember the first day you came back in, because with Lyme, a lot of times is what happens is people will still either feel normal or feel bad, and then all of a sudden they'll wake up and they'll have this day during this procedure or these herbs, they'll have a day where they wake up and they actually feel really good, and they're like, oh my gosh. And so they'll feel good, feel like they have energy. They might get that for a day or two, and then they kind of fall back into it again. And so there's a lot of ups and downs during that 2 to 3 month period of time, and you start moving towards more ups than downs. And so I actually remember the first time you came back in, and you're like, I feel really good. And I was like, fantastic. I'm going to feel really bad when you call me tomorrow. And you tell me like, and it happened, right? Like it happened. You came back in and you were just like, okay, I don't feel good anymore.
Yeah, I'm sure it did.
Yeah.
I remember I started taking it, and then like a week or so in, that's when it really hit. And we ended up moving in with my husband's parents because
you're having a hard time.
I could hardly take care of myself.
Yeah.
Like the goal for the day would be to get from the bed to the living room couch, you know, and then whatever energy I had by the end of the day was gone. And so a lot of times, even my husband had to like feed me a lot of the time because I didn't have the energy to do that. But I just felt like, you know, my body was just working really hard on trying to get rid of the Lyme, you know. But yeah, I did have better days, you know, like a day where I was able to go out to the store for a quick trip and then come back. But towards the end of the treatment, after the 2 months, I woke up when Nephi's alarm went off, and I just like almost felt like I was buzzing with energy. And it was the weirdest thing, so I don't even remember the last time I felt that energized. And I even like got up then, and I didn't have any joint pain, and I didn't feel weak, and but that was like like I didn't have any bad days after that.
Yeah. And then, which is perfect. And so I'm gonna actually make just a quick note too with her, and then we'll actually call it done. But so then it was gone. And there was a couple of things after that. I remember she came back in, kind of dealing with a couple other things, and we had to actually still work through kind of support her nutritionally, because after so many years of battling an infection like that, it really does deplete your body of quite a few things. And so then from that point, we could actually give her the nutrition. We could get her this like kind of your more vitamin, mineral stuff back in her. Before it wasn't really having an effect. Now it was. And so then we were able to kind of continue to help her improve. So perfect. Fantastic. Thank you so much. And that's going to be hopefully one of, hopefully many different interviews talking about Lyme and some other things that we work with in here. Thank you.